Real news for Americans 50 plus. This is Emeritus News Channel.
So let me now turn this over to Dr. Fauci for some updates on the clinical trials.
Thank you very much, Ann. I have a brief update on some of the results of clinical trials related to questions that have been commonly asked of us regarding the timing of administration of the seasonal flu injectable versus the H1N1 2009 vaccine. We embarked on a study in August involving 800 individuals to determine that if you give both of those vaccines simultaneously, one shot in one arm and one shot on the other, would there be any interference in the immune response to either of them because of the co-administration? And we have now the early results from the first groups of volunteers involved in that study, and we're pleased to report that the vaccine, when given simultaneously, does not impair the immune response to either of those, and that, I believe, is going to be important as we roll out the vaccination program, and individuals will go to their offices and would like at the same time to get both vaccinations. So that's the first updating on the clinical trial. The second has to do with a follow-up and extension of the data from the original studies that we reported several weeks ago, namely the dose and number of doses required for healthy adults as well as the elderly. You recall we first gave 8 to 10 day data which looked good and was suggesting to us that one dose of 15 micrograms of unadjuvanted material would be sufficient for the adults and the elderly. 21-day data came in and confirmed that, and what we now have data on are the data of 8 to 10 days following the second dose. And there's no substantial difference between the 8 to 10 day data following the second dose than 21 days following the first dose, which means that that just confirms the concept that a single dose of 15 micrograms of unadjuvanted material is sufficient to induce a robust response that you would predict would be protective. And then finally, we're just launching now, and we have no data, trials that we had discussed briefly, namely looking at the responsiveness in individuals with various levels of severity of asthma who are on corticosteroids. We're going to start that study next week, and we're also going to be initiating a study on HIV-infected individuals to determine what the proper dose and dosages would be for those groups. So that's my update on the clinical trials. Thank you.
Thanks, Tony. So I think we can now go to the questions, and I'll be moderating this and then refer questions to Dr. Fauci and Dr. Goodman that are appropriate. So let's start in the room here.
Thanks, Mike Stobie from the AP. Can Dr. Fauci hear me?
Yeah.
Yes, I can hear you fine.
Doctor, I had a question about what you just said about the two doses administered at the same time. Is that true for the nasal spray also?
This was in the injectable, so the study was not done with nasal versus injectable. This was just done with the injectables of both. So it isn't that it isn't going to be comparable, but we don't have data in that regard.
Just to expand on that a little bit, we aren't right now recommending giving two different nasal vaccines at the same time based on just theoretical ideas that there might be some competition. But it's heartening to see the data from the NIH about the excellent results with simultaneous shots. So that's consistent with what we've been recommending. Let's do another question from the room. Back there.
Hi, Joanne Silberner from NPR. Question to Dr. Fauci is how many people were in that double dose trial, in the two separate doses trial?
Joanne, there were 800 people, 400 healthy adults and 400 elderly. The data that I reported on were from 50 of those individuals.
Okay, let's take a question from the phone next.
Thank you. The first question is from Helen Branswell, Canadian Press. Your line is open.
Hi, thanks very much. I have a question for Dr. Schuchat. I'm wondering if you can tell us whether you're seeing, I know last week CDC was saying in some places it looked like activity was actually beginning to subside and a little suggesting that people might have been past their peak. But in the spring wave in Japan and some other places, they sort of saw a rise, a bit of a subsidence, and then another rise. Are you seeing that anywhere?
Yes, that's right. Today on our website is the updated weekly report we call FluView, and you can see there both national and regional graphs. Nationally, the influenza-like illness did dip a little bit last week, but it's up higher this week than 2 weeks ago. It's up to 5.1% of influenza-like visits. If you look regionally, there are some regions that things looked like they were going down and now they're going up. Within the region, though, there may be important city differences. We do think a number of cities in the southeast are seeing drops, but there are a lot of other places that are seeing increases. And as you said, with the Japan data, similar data in New York City, they had multiple peaks there. So I think for all of us, it's really too early in the influenza season, particularly with this H1N1 virus, for us to be able to predict the next several months. Next question from the phone.
The next is from Betsy McKay, Wall Street Journal. Your line is open.
Hi, I've got a question for Dr. Schuchat and one for Dr. Fauci. Dr. Schuchat, I wanted to ask you about the pediatric deaths. You said we're now up to 76 children. Is that since April, or is that just this fall? And do you know how many of those children had underlying conditions versus being perfectly healthy? And then I have a question for Dr. Fauci, which I can give you either now or after.
Sure. Yeah, let me handle that, and then we'll go to his question. The 76 children is since April, since the virus emerged in April. We saw a peak of pediatric deaths, starting April, May, June, and then it started to level off this summer, and now it's starting to shoot up again. So we're kind of in that second increase in the pediatric deaths from the H1N1 virus. The majority of children that we have information on have an underlying disease, but I think 20 to 30% of them do not. As you know, we reported in the MMWR about fatalities, and we did find that among people without an underlying condition, bacterial co-infections were a very important problem. So we're reminding people, clinicians, that it's important to think about those bacterial co-infections in terms of antibiotic treatment, and also we're reminding the general public that we have vaccines against some of the things that can cause bacterial pneumonia following influenza, including the pneumococcal vaccine that's recommended for adults, also a good pneumococcal conjugate vaccine that's recommended for children. So these pediatric deaths do seem to be increasing substantially the past month, probably related to this whole increase in influenza illness that we're seeing. Then you had a question for Dr. Fauci.
I was wondering if you could catch us up on where we are with adjuvants. I mean, I know we're not using them now in the U.S., but have you been doing any testing with them, or?
We started a couple of weeks ago the adjuvant trial. We don't have any data right now. The 21-day post-first dose data is going to be available in late October to early November. So it still holds true that we're not intending at all to use adjuvants in our rollouts of our immunization programs, but we are proceeding with the clinical trial just as a contingency plan, but the data won't be available for another few weeks.
The next question from the phone.
The next from the phone is from Rob Stein, Washington Post. Your line is open.
Yeah, hi. Thanks very much for taking our questions. And I also have one for Dr. Schuchat and one for Dr. Fauci, if that's okay. First one, again, is looking for a little bit more detail about pediatric deaths that you described, Dr. Schuchat. If you could tell us what was the age range of the children and what were the underlying health conditions that they had?
I don't have these are all children under age 18. Our website right now, if you go to the cdc.gov H1N1 site and look at FluView, it breaks out the pediatric deaths by age. I don't have those in front of me, and maybe we can send that part out to reporters after the call. And underlying diseases, we don't have that information for all of them. So I think that what we have seen in general, and in fact there's a report in this week's issue of the New England Journal of Medicine which summarizes underlying disease information for 272 people hospitalized with the H1N1 virus, that underlying diseases in children and adults include asthma, chronic lung disease, chronic neurologic conditions, of course diabetes, and then pregnancy. In children, neurologic conditions, severe ones like muscular dystrophy and cerebral palsy, are quite prominent, and so that would be available through the New England Journal paper that we just issued, but it's not in our FluView data.